now it's recording on ours as well.
Muy bien. Okay, so we're called to order.
Mhm.
Do we need a quick set of introductions? Are we introduced?
I think we should, why don't we do introductions? Because I didn't have that on the recording.
Okay. Well, I'll start. I'm Ann Charnhorst. I'm from Maui College. I'm a nursing teacher, and my hand was put behind my back and I'm back to department chair again.
You want to call the next person?
Well, also I'm gonna follow my little list along. So Dr. Oliveira.
Hi, Carrie Oliveira, workforce researcher, Hawaii State Center for Nursing.
Nice. Linda.
Hi, I'm Linda Beechnor. I'm trying to be retired and I'm vice president of Hawaii American Nurses Association, which keeps me more than full-time busy.
Very good. Thank you. Okay, Gloria Manawahine.
Gloria Fernandez. I'm with the Department of Health, Public Health Nursing Branch Chief.
Thank you for doing that job. Aloha, Rose.
Aloha, my name is Rose Hata, Director for Queen Emma Nursing Institute at the Queens Medical Center.
Very nice. Catherine.
Aloha, everyone. I'm Catherine Penn-Davis. I am the Director of Community Partnerships at UH Manoa School of Nursing. I am here tonight, though, in my other role as Associate Director in charge of EBP programs at the Hawaii State Center for Nursing. Thanks, Anne.
Thank you. Aloha, Sandra.
Hi, everyone. My name is Sandra Lee G. Brandon. I'm the Vice President of Behavioral Health and Medicine at the Queens Medical Center.
Ooh, that's a job, sister. How about you, Miss Jeanette?
Aloha, everyone. I'm Jeanette Ayers Kawakami, Director of the School of Nursing at UH Hilo. And I apologize. I'm not sure why my video is not working, but it says it can't load my camera. And I have never had that happen before, so I have no clue what's going on. But I'm going to keep trying.
Go for it. You can see and hear us, and we can hear you, so we can still enjoy your participation.
Yes, thank you.
All right, so that's everybody. So I am going to read the public comment for these agenda items as somebody requires. So here we go. Oh, that's easier to read than the other one. Any interested person may submit testimony in writing to the board on any agenda item by regular mail, email, or fax. An individual or representative wishing to testify in person should register prior to the start of the meeting so that we can introduce them and see them. Testimony must be related to an item that's on the agenda, and such person shall be required to identify the agenda item to be addressed by the testimony. You can submit your testimony by one of these following methods, email, fax, or snail mail. And each individual is allotted 5 minutes or an amount of time otherwise designated by the chairperson to provide testimony to the board. Individuals who can't provide testimony at this time will be allowed an opportunity to testify when the agenda items are called. For internet and phone access when testifying, identify yourself, please. We don't have any of those today. All written testimonies are public documents. Therefore, any testimony that's submitted orally in writing, electronically, or in person for the use in the public meeting process is public information and will be posted on the board's website. So that's that. Take it away, Laura.
Thank you so much. And I appreciate you introducing us and reading all that, all those statements for us. We have a great agenda today. Carrie and I are going to be giving some updates about our programs, and then I'm going to be doing a lot of talking afterwards, so my apologies, but we'll go over the legislative session, the Center for Nursing update, upcoming events, and then we'll adjourn. So with that,
I see Clementina Seriula here.
We
Hi,
we did a
Clem.
round of introductions, Clem.
Hi, Clementina Seriulep, Dean of UH Manoa School of Nursing and Dental Hygiene. Thank you.
Thanks, Clem. All right. So starting off with the program updates, we're going to give updates on the well-being and the research initiatives. The first update is related to the healthy work environments. This has been an interesting project. It started in 2021, and it started with a lot of us raising our concerns about the nursing workforce. Carrie developed questions and put them into the nursing workforce supply survey. So we have 2 years of well-being information that is expanded from our very basic recruitment and retention questions, which formerly were like, are you staying in your job? Are you planning to leave your job? Are you near retirement? And she expanded those to have a lot more questions about well-being in the workplace, and also things like sense of satisfaction, but also asking questions about feeling like safe at work. So the spectrum of well-being, from poor well-being to good well-being. She has 2 years of data. There's going to be a 3rd year coming up because we are in a licensing renewal cycle. So we're going to be able to start trending that data. We have a tiny trend, and now a baseline to second survey trend. Now we'll have three surveys worth of data at the end of this year. We also worked with our CNO group, our CNO collective, to create a subgroup on well-being. We called it the Wellness as a Factor of Recruitment and Retention subcommittee. And we looked at background literature on those 3 topics: well-being, recruitment and retention, and then we synthesized them and found the key themes across the 3. We have that information on our website. And then we developed priorities. So around that time in 2022, the Nurse Staffing Think Tank and the Nurse Staffing Task Force came out with recommendations that were at an organizational level. And we said, what can we do at the state level? So we identified priorities, and you can see that those priorities, we ended up organizing them by Maslow's hierarchy, and you can see that to the left. So healthy work environment, total compensation, and work schedule flexibility in a category that we kind of, in our shorthand notes, recognized as staffing stabilization, and then innovative care delivery models as kind of the highest tier. We started conducting continuing education activities. We've had 2 series, and we've put some of those onto as enduring activities, which are now completed. They're no longer posted. They expired at the end of the year. At the end of 2024, but we've had about 9 of those continuing education activities over time. We have been reviewing policy and legislation. Last year, there was a lot of initiatives related to whether employers could take out TROs on behalf of their employees who are being threatened or experience violence at work. Also increasing the felonies for people who assault healthcare workers. Not a lot of progress was made, but we already do have a law that's passed. It was passed in 2018 that establishes a Class C felony for people who do knowingly and purposefully assault healthcare professionals. So if you are not in a good state of mind and for instance, you're delirious and you throw an arm and that hurts somebody, that is not a knowingly and purposeful assault. It's, but if somebody purposefully causes harm, they can be subject to those felonies. We also, just in December, I submitted a nursing workload task force proposal to the governor asking for work for a dedicated body of people to address workload. So not the issues related to staffing, because that is an employer-employee or an employer bargaining unit negotiation, but rather look at the factors that do increase workload and how can we relieve those factors as a state. We're still in discussions about that. So that proposal has been submitted. The work has not started, so that proposal wasn't necessarily adopted. That's what we're working on now. We did post a position for priority for the priority coordination. So that's going up the priority development. So working on these initiatives and putting these initiatives into action. I did end up closing that application, and we're going to restart it, particularly because we're about to have the strategic planning results, and so it seems relevant to reflect on the findings that we've heard from our community. And so I wanted to thank specifically the board members who are on that review. Thank you for your help and your time on that, and we'll keep on pushing forward in a couple months. And then we do have Catherine and Leanne are going to launch our first ever statewide EBP project on well-being. I think she's doing, I don't know what dance that is, but she just did a dance about it. We're really excited. I was also reading an article, Catherine, that I'm going to share with you about well-being that I thought was really exciting. So there are organizations across the state who are willing to all work on one project together. And then when we get to the implementation phase, take that back to their organizations for organizational implementation, but kind of trying to move together on these initiatives. And then we are holding a focus group on well-being tomorrow. So there's a lot of work, and sometimes it doesn't feel like we've made a lot of progress until you put it down on paper. So I wanted to share that even though we don't have a staff person, we don't have necessarily the program created, all of the staff have dedicated their time to addressing and integrating these concepts into their work, and we are forming something together. So we're making progress, and we're bringing attention to this issue. And what is very interesting to me as well is throughout the focus groups that we've already had, some of these concepts have been coming through. So I think that even the priorities within well-being were good ones, and are ones that we will continue to work on even after the strategic plans are set. Sorry, I started stumbling on my words there. With that, I'm going to pass it over to Carrie. So I'm going to stop sharing, and she's going to start sharing.
Hi, everybody. Gloria, be careful. The rain has started in Kapolei. I don't know where you're at, but be safe driving. Okay. So I want to give an update about what's going on with research at the center. So I'm going to start by talking about what the heck? Supply and demand projections. So, and then I want to give you a little bit of update about what all has been going on in the way of new releases and things that are coming soon. So the first thing is a reminder, I think the last time I gave a formal update to the board about our workforce projections was at our our August meeting in the summertime, I think was the last time. And at that point, we were still dealing with the ever delightful contracting process. So we did finally get through that, and most of the work is done now. So we actually have a final report due. I'm going to say final report due from Global Data in just a couple of days. And Laura and I will look at that, make sure that things make sense to us, and then we'll have an opportunity to send revisions back to the vendor. But as a reminder, we contracted through a competitive bidding process, Global Data Publications Incorporated. These are the same folks who model HRSA's health workforce projections. If you've never looked at those, I have a link here in the slide deck, so you can take a look at that. Their deal for us was that they were going to project supply, demand, and adequacy of LPNs, RNs, and APRNs, all roles. I should have said all roles except CNSs, because CNS is not actually a role according to the federal government. So there's not a lot of data about them, but NPs, nurse anesthetists, and nurse midwives, and then within NPs, several NP specialties. So there are lines for that. And basically the conclusion that they were supposed to draw for us is, do we have the nurses we need in order to take care of the population? And their model is based on utilization. So whereas the Healthcare Association of Hawaii does a demand survey, what that means is they ask employers, how many budgeted nursing positions do you have in your organization, and how many of those are vacant? Vacancy there would demonstrate a shortage or an insufficient number of nurses. Here, the model is based on healthcare utilization. So they take a population of a given size with given demographic characteristics and a given health profile, and they estimate how much healthcare utilization that population is going to need and how many nurses they're going to need to deliver that care. So that's what their model is based on. The reason we opted to do this was because it's been at least that Laura and I can figure out at least a decade since the last time there was a nursing workforce projection. either done by the Center for Nursing or commissioned by the Center for Nursing. We thought, well, it's about time. We really want to encourage evidence-based and data-driven policy decisions in particular. And if you pay any attention to the legislature, wow, sometimes there's just no data involved in some of those decisions. And we really just want to create opportunities for data to be available and inform good policy making. And in particular, the reason we didn't want to just rely on HRSA's version of Hawaii's projections is because that model is really based on federal priorities and it doesn't include Hawaii specific data. So the model that we commissioned Global Data to do for us included our supply data. So it adjusted some of the assumptions of their microsimulation model for the supply side, as well as the demand microsimulation that they use is the same as they use for the federal government, but it was validated against La Lima Data Alliance data related to hospital discharges. So we were able to see whether or not what they were anticipating or what they calculated was the probable utilization of hospital services. We were able to validate that against our own data. So we have every expectation that what we're getting from them is more accurate and more in alignment with our actual workforce conditions than the federal model would be. That's not to say we didn't have some growing pains. There were. They gave us a preliminary projection. It was bonkers for RNs in particular. They were telling us that we had like a 2,000 RN surplus. And we were like, well, we don't feel like that's resonant with reality. So we kind of had to figure out where their model was coming apart. We identified a couple of places where they didn't use our data where they could have, and we shored that up. So I'd like to, if you will indulge me, show you a couple of highlights from the projections. So the first one, this is not as visible as I was hoping. These lines are really skinny. I apologize. I will draw attention to the things that are important. So this is our LPNs. And this black line here is demand. How many LPNs do we currently need in 2022? And how many will we need going into the future to 2037? This line way down here is how many LPNs we actually have. This number is less than 1,000. This number is about, what, 2,800, I think is what that is. That's a shortage, my friends. That is an egregious, hideous shortage. Now, I will say the LPN data is, I think, in their microsimulation, a little interesting because I think it continues to reflect historical patterns of LPN utilization. And I was just at the forum, the National Forum of State Nursing Workforce Centers strategic planning meeting or subscriber meeting, and there was a lot of conversation amongst the states that were there about LPNs going away. And we're not sure what's happening. I mean, we know what's happening, but there's a definite decrease of overall in the number of LPNs. And so what that means is as the LPN workforce shrinks nationally, their microsimulation model is going to have some adjustments made to the assumptions underpinning it. So I think right now we're looking at some old assumptions about LPN staffing. Either way, this is consistent with what we've been saying since at least 2019. We don't have enough LPNs. Our employers are saying they don't have enough LPNs. And unless we start producing like, I don't know, 4, 5, 6 times as many LPNs as we're actually currently graduating, we're never going to meet this demand. So that's great. But thanks to like UH Maui College for its CNA to LPN glide path is making a huge contribution to the LPN workforce. So at least that is optimistic news in the context of this really kind of dire picture of what's going on with LPNs. So we'll shift away from LPNs and talk about RNs for a minute. Really interesting lines here. Again, this black line here is demand. So this is the number of RNs we need. So you can see at the beginning, the baseline year of the model in 2022, we have about as many RNs as we need, which despite HAH's workforce demand study saying that, oh, there's 1,000 RN openings, there's plenty of reasons that you would see RN openings that don't necessarily reflect the fact that we don't have enough RNs in the state. It's a point in time. We don't know when that happened. They might have been, hiring into vacancies at the time that the survey was completed. So this is really, again, focusing on how much healthcare utilization are we using based on the population. So if you take a look at that, what they're basically saying is that we're going to have more nurses, the supply, red line. This might be interpreted as an oversupply. That is to say, we have more nurses than we need. And they actually very aggressively cautioned us against drawing that conclusion. The thing that we prefer to say is that Hawaii staffs differently than the nation. And the reason for that is because economy of scale. We cannot scale our workforce. We basically have to create an entire healthcare system on every single county, because unlike places where the counties are contiguous and you can move, a nurse can work in, I don't know, Austin and San Antonio if they were willing to commute. That isn't really happening here. It could, but it doesn't. It's prohibitive. So we really have to replicate things that might otherwise not be replicated. So we think that there's an underestimation of staffing for Hawaii based on their model. And that's something they're going to discuss in the final report for us. The two things I did want to draw your attention to, the reason there's more lines on this graph than the previous one, is that this blue line would indicate fewer graduates. What would happen to the supply of nurses relative to demand? This is RNs again. If we reduce the number of graduates we're producing from our local schools, you'll notice that by 2030, we would have a shortfall. We would have too few nurses for what we need in order to meet demand if we constrict our nurse education programs. Similarly, this purple line here is if we see an increase in the number of RNs who decide to retire early as compared to the national average of retirement age, then we would also see a shortfall under here. So what I think the two big takeaways I want to draw for the RN data is that where there is growing demand, we're going to see a steady increase in the demand for registered nursing services. And this red line should not be interpreted as we have too many and we want to avoid a knee-jerk reaction of like, oh, we should cut funding to our public nursing schools. We should not be worried about nurses retiring. We should, because we will end up with a shortage. And so that's sort of the message I want to bring home about the RN data. Really quickly, two kind of notes about our NPs. These data are suggesting that we have an oversupply of NPs. So this is demand. And this is demand. This green line is demand. If everybody could have access to care in the same way that the most access people have access to care, there were no barriers to accessing care. We're seeing an oversupply of NPs. The thing about this one is like, this only looks at NP roles. And what it doesn't look at is like the provider environment altogether, because physicians occupy a lot of that space. And so it's not entirely clear to me yet. And I would like to hear more about global data. They're going to come and they'll present the data and the projections, but kind of to what extent does the NP projection or oversupply sort of fit into what we know is an existing shortage of physicians, particularly for primary care? And then the other thing I wanted to draw attention to was this kind of alarming finding. We asked them to run a scenario that included an increase in the supply of psych mental health nurse practitioners because we opened several psych NP programs across several schools in the state here in recent years. So if we take the year that we start to expect these students to be graduating, so this year is at least one school is going to start producing students. Based on the expected demand for psych mental health NP services, we're going to see a significant overproduction of nurses. And so what this might mean is that, hey, this is great. We're going to expand access to psych mental health services so people might actually use them more. So we might see an increase in demand that matches the availability of a supply, or it may suggest that we might need to correct the enrollment targets for some of our psych NP programs so that we don't glut the market. So these are some of the highlights. More of this is going to get discussed in the report, which is forthcoming. And then, like I said, we're looking, I think right now, the first week of April, we're settling on a venue to get a specific date, but we're going to bring Clark Ruttinger out, who is basically our account manager at Global Data for all of this. And he's going to come present the data, answer questions. So we're going to put out an invitation. It's going to be about a 40-person event. So you'll all be invited and you'll be welcome to come and ask questions if you would like to do that. Any questions about, I think I'm over time on that, but any questions about the projections?
So this is Clem Carey. I
Hi,
have
Clem.
a few comments for the RNs. I think even the the phenomena that's beginning to happen where we have newly graduated nurses leaving the field because
Yes.
they were exposed to lack of or no exposure to clinical, right? And when they go into the chaotic environment of the hospital, they're not ready. So we see that they are leaving. And also we're finding that our graduates or even students have so much psychosocial issues that if we release them to practice, they may not stay in nursing as well. So I think those are considerations. And for the NPs, I'm getting a lot of inquiries about specialty shortages.
Mm-hmm.
Like those who specialize in oncology,
Yes.
hematology, pediatrics. That's.
We
Mhm.
do have some data in the projections related to NP specialties. We had to roll them up because our individual NP populations within those specialties are too small to do individual specialty
see.
projections. But when we put out the final report, those a bit more nuance will be provided as it relates
Okay.
to those specialties. I don't know if it'll be at the level of detail that you're hoping for, but
Mhm.
certainly more detail than I provided here. And I didn't include any of those. I only focused on the psych and the primary care, but we do have the other specialties.
But appreciate the segmental health data because that's
Sure.
important for our planning. Thank you.
Sure, no problem. And to your point about exits from the workforce, that was one of the variables that we provided to global data that was part of their kind of expectation of when nurses will leave the workforce. And so we provided data from our workforce.
Mhm.
So when people indicated that they were planning leaving, how many more years they were planning on remaining in nursing. So that was definitely something we provided to them. So to
Mhm.
the extent that our new grads were saying, no, I'm planning on leaving, which by the way, our data doesn't suggest that large numbers of them are. But to the extent that that is the case, it was reflected in the supply side model.
Okay, good. Thanks.
Thank you. Other questions? Okay, I'm going to be really fast, I promise. Okay, so upcoming stuff or new releases, we have infographics. Woohoo! Leanne Hussey for the win. Made these. We have advanced practice registered nurse and registered nursing. We have an LPN one forthcoming, I think. Pretty sure these are both linked, by the way, in the deck. So you have both are linked to the reports page as well as the individual infographics for your enjoyment. We also did a webinar. So we've launched our new online learning management system for our CE program. So I recently did a kind of an overview of the new graduate workforce, and we talk a lot about what their intent to stay is and job satisfaction and et cetera, things like that. So those data are available. The Enduring podcast or the Enduring webinar is available in our learning management system, and also some data tables. I'm finalizing the formatting, but those should be up shortly. So additional data about the new grad workforce will be available shortly. And then upcoming exciting stuff is that, as Laura pointed out, this is a license renewal year. It is my favorite. It's like Christmas for me, an odd numbered year. So we're going to make a couple of small tweaks to the nursing workforce supply survey. Mostly we don't plan on changing it very much in order to preserve that time series. So we'll be collecting the data between April and June 30th. And then we expect our initial data release, most likely data tables by August 31st of this year. And then our education capacity survey for academic year 23-24 is going to go into the field in February. So the schools are going to be getting that. Thank you to all of our educators on the phone who are probably going to get an email from me asking to complete the survey. Our tentative release date for that report is going to be November 30th. So that's what's up. Any questions or comments? As always, if you have questions, let me know.
Great job. Thank you.
Thank you.
And we actually have 20 more minutes. So if there is anything we want to talk about related to well-being or related to the data, there's plenty of time.
I will throw one other thing in, if I may, then, if that's the case. So one of the other cool things I want to tell you guys about is the National Forum of State Nursing Workforce Centers and National Council of State Boards of Nursing collaborate to do the National Nursing Workforce Survey every 2 years. They collected data in 2024. I'm a co-author on the large paper. That one just went to the Journal of Nursing Regulations, so it's under review right now. Should be coming out as a supplement April or May-ish of this year as a supplement to the Journal of Nursing Regulation. The other thing that is happening is the forum and the NCSBN are collaborating on a couple of kind of specialty sub-analyses from those data. So delving into things like who's the APRN workforce nationally? What does burnout and job satisfaction look like, especially among early tenure nurses? Either so we had a meeting about how we were going to prioritize those. So more of that delving deeply into the national nursing workforce data is going to come, which is going to give us an opportunity to compare a lot of the subset data analysis that we like to do for Hawaii. We'll have a national comparison to look for that on. So I'm really excited about all that work. So that's the only other thing I wanted to share.
That is awesome. Thank you. And I saw that Samsung SMS918U unmuted themselves for a second. Do you have a question? And maybe could you introduce yourself?
Hello, this is Arthur. I'm calling from my phone.
Oh, hi, Arthur. It's
Sorry
so
I was
nice
late,
to
but
have
I
you
caught
with
the whole
us.
presentation, Carrie. That was awesome.
Good. Thank you, Arthur.
I love the informatics. I was wondering where the latest ones was.
You got him
But
now.
great stuff. I know, perfect. I share that with everybody.
Oh, good.
I got
I'll
one.
let Leanne know.
Yeah, I got one question.
Shoot.
I think we talked about how we can get more participation in the survey when we renew our license.
Mhm.
I think we had a brainstorming session on that. I totally forgot what we talked about, but can you refresh my memory and how we can get better participation?
I think basically the things that we talked about were really kind of trying to improve nurses' awareness of the survey and what the data even do. And I'll say that the going to the strategic planning sessions, the focus groups that we've been doing has been extremely informative. It reinforced something that I think we've had a sense of for a long time, is that I think one of the biggest barriers to nurses completing the survey is that they have no dang idea who the Center for Nursing is. They don't know who we are. We don't know what the data is for. And so, we've gotten a lot of huge support, especially from our hospital employers, helping to advertise the survey and encourage their nurses to take it. We did have the biggest sample, like biggest raw number sample for the survey in the history of the survey in 2023. So it is my enthusiastic hope that we're going to continue to have that employer support to help generate awareness within healthcare. That is hospital specific, though we have a very hard time tapping into any other employment setting pretty much. So I think we're going to do a little bit more outreach to our non-hospital settings.
Yeah.
And then whatever our strategy is for helping nurses in general understand who the Center for Nursing is really where we kind of the root of how we solve that problem.
I totally agree about the outreach. I've done my own survey on surveys, and I talked to like private physician nurses and insurance case managers out there, and they pretty much had no clue. People outside of my facility. So I mean, the nurses out
Correct.
there didn't have a clue.
One thing that I find is if you say, hey, that survey that pops up, and particularly now that it does pop up once you anything you click, it'll pop up. It's like, oh, that survey. And then if you say, oh, this is how we use it, people are pretty excited. So I talked to, actually, I don't think I've circled back with you, Carrie, but I talked to Leanne about making kind of smaller infographics that can be in the newsletter that we push out over the course of the license renewal period, that it's like, hey, this is the data and this is how we used it. Like we use what you tell you, and so they can see it. So kind of that visual reminder, because we have a much larger newsletter subscriber base. Is that how I want to say it? We have many more people who receive our newsletter than we have in years past. And so we can use that as kind of like a some passive marketing and active awareness activities for the survey.
Okay, good. Yeah, even if I see, I tell them, but I'm finding a lot that don't know about it.
I think a lot of people do it and they don't realize that they are engaging with the center. So I think there is more uptake than particularly last year. The survey responses were wild last.
I hope that that's the case. I like to think that yes, more nurses are taking the survey than realize what they're doing, but we still know about half of them aren't doing it. So there's definitely an untapped pool of folk people in.
If anybody else has ideas as well.
Sorry, Laura, what?
I said if anybody else has ideas for that engagement as well, we welcome it. Linda does.
Certainly, I'd like access to infographics and anything that you want me to use to promote as far as Hawaii American Nurses is concerned, and even to send it out to the various unions to publish.
We'll get you all the things that we send out. We will send them to you, Linda. Thank you. We really appreciate you guys being willing and enthusiastic ambassadors of the survey. So your word of mouth is much appreciated. Anything else I can answer for you guys?
That's all I have. Thank you.
Thanks, Arthur.
I have a suggestion. So
Shoot,
I
Rose.
see this model used for probably professional organizations like an HSCN. They recruit ambassadors. So like ambassadors get like specialty email and like, hey, kind of get directions like every quarter, like please promote this, please share this. And then they get like special perks on getting some supplies to like hand out. And then they get highlighted as an ambassador. And then, and then you utilize these people as influencers to get the communication out. Just FYI.
We need Center for Nursing influencers. Yes, I think that is going to be an important part of our strategy going forward. Thanks for that, Rose. I appreciate it. Thanks, everybody. I appreciate you.
Right, I'm gonna go back to sharing. Trying to decide which is the correct screen to share. Does that look right, you guys? Everyone? Okay. So legislative updates, we are in our legislative session right now. The legislative session starts the third Wednesday of January and ends the first Thursday of May. So that is January 15th through May 2nd of this year. The legislative cutoff for bills is basically a week and a half after the legislative start. So the start of the legislative session again was January 15th. The last day to introduce bills was January 23rd. So I guess it's 6 days. There's a little bit of a tapering effect. So the most bills are introduced early, and then as time goes on, it kind of slows down. But there are 3,000 bills introduced, and we review as many as we can. I generally do keyword searches to get at the biggest breadth of bills, and then I weed down until there's a more reasonable list. And then I start talking to other people, make sure I'm not missing anything, or if I found something they haven't. So we have a kind of a network of people in healthcare that make sure we're all working together. I have identified 110 bills that we're looking at. We're not going to testify on that many by any means. But there are 110 bills that have some kind of nursing or healthcare related impact or content that is pertinent to recruitment and retention, nursing workforce, well-being, evidence-based practice, quality care, etc. Of those bills, I identified some themes that I wanted to share with you all today. So ratios, recertification, education and entry to practice, APR and barriers, workforce development, scholarship and loan repayment, and reimbursements and GET tax credits are the themes, the really big themes that I saw this year. The two in orange, I have a little bit of a deeper dive so we can look at those topics. And if we want, we can look at the Capitol website. But I want to talk about these because it's really important to make sure that, and Carrie mentioned this, that if you do evidence-informed policymaking, and that's what the Center for Nursing, that's what we hang our hat on, just like we do evidence-based practice, and we believe that we should, as nurses, we are scientists, but we're doing it in a way that we apply the science to the practice to make sure that we're going to a better future. That is also possible with policy. So we do this, and we want to make sure when we do this analysis, when we do policy review, we want to make sure that we're thinking about the full reality. We are thinking about the problems, we're thinking about the opportunities, we're thinking about the need, we're thinking about the data that informs it, and then also the feasibility, and it moves all forward. So when we do that, what are we seeing here? And how the conversations that we had just a moment ago, particularly Carrie's presentation about our workforce projections, does this look like it is on the same, are we in the same book? Are we telling the same story? Are we on different pages? What's going on? So ratios, we had a conversation about nursing, that employers maybe employ nurses at a higher rate than across the nation, but the demand is very high. So when we're talking about workload, we also had a conversation about well-being. So if we're talking about workload, we're talking about staffing, we're talking about stabilization, it makes sense that this topic, ratios, is going to come to the legislature. Recertification. So there is this conversation, Clem, you mentioned it. Are trained nurses leaving the profession? And if they leave the profession, how do they get back in? And so there is the official terminology is relicensure and recertification. If this bill moves forward, we would want to make sure that the language is aligned with the Board of Nursing laws and rules. But recertification, which I believe the intent is to talk about relicensure, is if any one of us who's a licensed nurse on this call takes a 5-year or more break, maybe, maybe you go to another country, maybe you start being a shoe salesman, maybe you are, whatever. You don't need your license for a couple years and you don't want the expense. There's a lot of reasons why nurses stop stop renewing their license. And to come back into practice, if it's been more than 5 years, they have two options. They can take the NCLEX, or they can take a 60-hour didactic and 60-hour clinical training that we don't have in the state. So this is a bill to bring that back. There's also a component to incent people to be nursing faculty. Education and entry to practice. So we had those conversations as well. If we're going to be addressing the workforce needs, we have to make sure, Carrie mentioned this with the RN workforce, if we produce less nurses than we have today, we're gonna tank below the line that we want to stay above or at. So that equilibrium will be lost by 2030 if we produce fewer registered nurses, and we are out of equilibrium with LPNs dramatically. And APRNs, what Carrie alluded to, is that they are responding to the loss of equilibrium with physicians. So where there are not physicians, APRNs are able to provide care. So that education and entry to practice is really important. APRN barriers relate to the ability to do work. Workforce development, again, relates to education. Scholarship and repayment relates to retention. And then reimbursements and G-tax again relates to that work environment, so that retention. So we want to make sure that when we're responding to these issues, that we're thinking about it in this greater context of recruitment and retention. What does the data tell us? What do our partners tell us? What are our focus groups telling us, or what are alumni, etc. Does this all tell one story, or different parts of one story? Does it fall in line, and does it move the story further? So those are the trends, and really I think that they all make sense. Nothing was super surprising to me. I think we have to explore some of the policy initiatives a little bit more, but nothing was like, whoa, what? Where in years past, there's been some kind of like curveballs. I didn't see any curveballs. I think all of this makes sense in terms of the topics, and it matches the narrative that we've heard or the data that we have. I am not on the screen. Let me. So I want to talk, the two orange ones are the ones that I want to talk about a little bit more in depth. The nurse ratio bills, there's 3 of them, and I'm sorry if this font is small, but we'll be talking about that in generalities. There's 3 bills that have been introduced. 1 Senate bill and 2 House bills. I have the introducers' names. So Senator Aquino is the labor chair, and he introduced a bill that would be assigned to the Department of Labor. And it's very similar to the House bill that Quinlan and a lot of other representatives introduced, which also assigns this work. It would be assigned to labor. So I'm going to talk about those first 2 bullets together, because you can see they're almost identical. Both of them create a new chapter. One is minimum registered nurse staffing standards for healthcare facilities. The other is minimum staffing standards for healthcare facilities. It establishes a minimum registered nurse staffing standard by hospitals or by facility type, by unit type. So it is a unit-based ratio. It is fixed. So it does say like 2 to 1, 3 to 1, 4 to 1, etc. That creates a minimum. So if you want to staff, if the ratio says 2 to 1 and you want to staff 1 to 1, you have it, you can go for it. If you need to staff below that ratio, there is a mechanism for there is a justification process and kind of a review and approval process. However, there is an enforcement language in there. And so it does both of them establish complaints and fine systems. Interestingly, in years past, there were some overtime language in these bills, and I didn't really see them this year. The third bill, so the bottom one is HB 62. You can see that fewer people as compared to the middle bill introduced this. it is assigned to the Department of Health, not the Department of Labor. So a whole different state department would be tasked with overseeing this work. Otherwise, it's very similar. I will bring your attention to the second bullet, which I thought was very interesting. So in addition to establishing the ratios, it also establishes a status for exemptions, staffing calculation requirements, assignments of RNs, use of technology, patient advocacy, record keeping, audits, complaints, and administrative sanctions. And the use of technology piece was really interesting to me. And let me pull it up because I copied this language in. It says that a healthcare facility shall not use electronic monitoring, including video monitoring or other remote monitoring, to substitute for the direct observation of a registered nurse or an ancillary staff person required for patient protection. For the purpose of this chapter, a healthcare facility shall not adopt policies or practices that employ health information technology, algorithms used to achieve medical or nursing care objective, systems based on artificial intelligence or clinical practice guidelines that limit or substitute for direct care provided by an assigned registered nurse, et cetera, et cetera, et cetera. And this was so interesting to me because in our focus groups, there was a big call for investigating how to use AI and how to use technology to assist but not replace nursing care. So when I saw it, when I saw that there was language about AI and use of technology, but it would prohibit that, that was really interesting, that it was very much in contrast to the narrative we've been hearing in this kind of appreciative inquiry process throughout the state. And I think that it's interesting that it's being used in relation to ratios. So that's telling that there is a question about how it can be used to replace a workforce as opposed to supporting a workforce. And I think that's a big qualifying difference that was actually made in our focus groups, as well as it's kind of alluded to in this bill. There is, and I don't have the committee assignments for these bills on this presentation, but we will see if there will be any hearings related to this. There has been a lot of conversation at the State of Reform. The legislators gave a presentation at the end of it was the very end session, and their last question is, are you going to support ratios? And there were questions about the impact of ratios, good and bad. I think that importantly, this opens up the conversation about how we support workload in nurses. So we know that recruitment and retention is not just about people, but it's about how the work, what kind of work there is. I just read an article, and sorry, I keep on looking down. The article is right here. I just read an article earlier today written, it was published in the Journal of Nursing Regulation in October 2024, titled Exploring Factors Influencing Nurses' Intershift Recovery and Its Effect on Progression from Acute Fatigue to Chronic Fatigue. So it's basically like, what's your rebound? What's your ability to bounce back to feeling rested between shifts? And the three factors they found was staffing and resources. The three workplace factors were staffing and resources, leadership relationship, and the nurse-physician relationship. And it also found that the type of shift had some impact. And they make the point, they go, in a position of nursing workforce shortages, you may not be able to require less work, but how you schedule and the environment during the workday may be enough to stave off chronic fatigue. So it's really being it's really focusing on those workplace environment factors. And then they also made a point that sleep and exercise also help rebound people. And so making workplace incentives to allow for that time or to incent that time and make sure a younger workforce, Clem, to your point, knows how to use these employee benefits and that they're optimizing the use of those benefits so they are recovering. All of that was really interesting. They were like, you're not going to, if you're workforce short, you're workforce short. So what's next? What's that next question? I think that is the subtext here. When you're talking about ratios, when you're taking it from an organizational conversation up to the state, it's important to think about the root cause analysis and what is the what's next, or how come, or what's the next why. So those additional questions need to come out. The next section that I wanted to talk about was education and entry to practice. There are, as you can see on the left-hand side of this screen, quite a number of bills that seek to expand nursing education. All of the bills that you're going to see in the legislature are going to be related to UH, because HPU and Chaminade are private institutions. They can grow as they want. These ones are really interesting to me. One, there's that recertification we talked about already. I have, and here you can see who is introducing it. It's kind of interesting to me because it's many other people. A lot more people are engaging in this nursing and education advocacy. The second bill is UH nursing appropriation, and that seeks to take the Board of Regents proposed initiatives for UH nursing workforce. So that's expanding UH Manoa's UH West Oahu Manoa BSN program, expanding UH Manoa's online to BSN program, and expanding UH Hilo's nursing program. We just happen to have Clem and Jeanette here. But so it replicates what was introduced by the Board of Regents and puts it into an appropriations bill. And then the state budget also has those same initiatives minus the online to BSN program. That one didn't make it into the state budget. And then the last one, did I miss one? Oh, I missed one. Sorry, there's one more that I missed, and I'm sorry I missed it. There is the DOE UH nursing education workforce appropriations. Part of that money goes to support the Maui LPN, CNA to LPN glide path. And then the one I missed, and I'll send afterwards, I apologize for that, is a proposal to allow UH Maui to confer a BSN. So you can see that that's increasing access to education by increasing enrollment, supporting certain enrollment types, and then also expanding or elevating the degree offerings in Maui. So that there's a lot, like I've never seen that much for nursing or really any other profession. Usually it doesn't have that much engagement. So there's a lot of engagement in how to produce more nurses in our state. And then with entry to practice, there is an interesting bill that would be assigned to DOH to basically cajole NCSBN and Pearson VUE into offering NCLEX testing sites across the islands. Oh, and then it's the recertification. You know what? What happened is that I have the wrong title here. SB 119 and HP 617 is the Maui College. I just have the wrong title, and I apologize for that. So it's pretty interesting. I've never seen so many initiatives aiming to expand nursing education through our state programs in my 10 years of doing this. But it shows that responsiveness and that interest in engaging in solutions to the problems that we've heard a lot about, particularly in this past year.
So
Does anybody have any questions? I saw one chat. Oh, Anne.
So with all these bills, but out of 3,000, what realistic expectation do we have to see some of these come forward?
I think it's a lot to do with your engagement.
Yeah, I think that's a good answer.
And that was, made clear to me when we made visits last year during the session to, consistently push for our request for the second year funding for our UH West Oahu. And the response from the legislators is, thank you so much for coming to see us, because we don't really understand the importance of this in your program. So they do. And when Representative Garrett did ask us to meet with him, again, he says, we'll be seeing you at the Capitol, right? That means they want to see you.
Yeah. I will post the correct title in the chat for SB 119 HB 617. I apologize for that typo. Linda, I saw your question. I'm not going to be able to log in and get that title and send it, so I'll do that after the meeting. She asked for the name of the article. Yeah, I do think it's engagement. I think it's having people understand. I think because nursing is so big and very nuanced, it's easy to be like, oh, you guys can handle that, right? Because it feels overwhelming. So also being able to communicate it in a way that is relevant to the layperson, which our legislators are lay people, and also responsive to the issues they're hearing about is really important. So starting with the why and talking about the how come, and the what's next, being very kind of like make sure that arc of your story is being told and connecting those dots for them. Okay, strategic planning. We're still a little bit ahead. We have more time to chat if you all want to chat. The strategic plans, as you all know, 2018 to 2023, and then we've just kind of been threading them along, stringing them along. Generally, they were fine. The strategic directives we outgrew, but what we were able to do is say there is, sorry, there's a bug flying across my face. I'm sorry to start batting at the air. What we were able to do is say, the first thing we wanted to do is strengthen our data. And the second thing we wanted to do is respond to what it was telling us, the data, both what Carrie produces, but also our community feedback. So we started a lot more community groups and coalitions. And then as we started to grow that body of data, then thinking about what do we launch and what do we move away from? And we've been doing that. We've tested a couple small projects. Some of them have grown wildly. Some of them we didn't continue after the pilot year. But we really want to move into a new set of strategic plans. We also purposely pushed out the strategic planning was not going to do anything looking far out in 21 or 22. Wrong time to do it, right? Too much was in flux. You need to let things settle a little bit. I don't know if they've settled, but I think we have more insight. So we started with our community focus groups. We are calling them discovery groups. We've had them October to January. Tomorrow, as I mentioned, is the last. Our topic, I'm sorry, the community focus groups, October to January. January 3rd was the last one on Kauai. Our topical focus groups, one was last Thursday, the next one is tomorrow. So we had one on education capacity, and then tomorrow's will be on well-being. We are working on a cumulative report with our consultant, Eric Capono, and he has already identified some themes, which I will share. So I will be bringing back together our two board, the two folks who are assigned to this initiative, so Gloria and Rose, to be a little bit more engaged in this process with the next actions before we bring it back to our community. So we will be coming up with our strategic directives and then our goals and then our measures. And that's a little bit of an iterative process that starts in February and ends in February. Actually, it's fast, but it's iterative. So we're going to kind of refine it very quickly. And we will launch a stakeholder meeting. All of the board members are asked to attend. And that will be saying, yeah, these are what we heard from you. This is what we think we can do. This is what we're committing to do, but we're asking for your commitment as well. And so our work is not on behalf of nurses, it's with nurses, right? So we're not in a position to tell the nursing workforce what is needed for them. We listen, we use the data, we respond. And so we also need that engagement to be sure that we're doing the right thing. So we can see that the outcomes, the number of people we had at the focus groups, our small little Kauai cohort, they were so wonderful. There was very few of us there, but it was a really good meeting. And what was cool is that it really did reinforce a lot of the themes showed up again. It felt like the same message, but we got some new information as well. We're expecting, so you can see that we've had over the course of all these focus groups, 154 registrants, and we've reached out to over 600 people to participate. So it's been a really nice activity. I'll give a shout out to Hawaii Island. They brought some of their nurse residents, which was so cool. There was a lot of crying that day. Good tears, not bad tears. They were like, because of the residency program, I do not feel afraid if I don't know something. I feel confident to go and find someone and ask for the guidance and the double check before I walk into a room. So when I do walk into a room, I feel confident and safe. It was like wild. People saying that they didn't want to leave and they didn't have to leave. So those really nice affirming conversations for us to know our work was on the right track, but also that aspirational kind of imaginary work that helps us think about the future. We will, and as I mentioned, we will have that final meeting on February 19th at the Prince Waikiki, and we do ask that you all are there. It will be a full day event. The emerging
It's
themes
the February 19.
February 19th, yes.
Okay.
Yeah. And invitations went out. So as soon as you respond to the invitation, then we send out RSVP and we'll put it on your calendar. The emerging themes, so the strengths, if you all recall, there's the strengths, there's the opportunities, and then the aspiration section. So the strengths that they identified in the center was collaboration and networking, data-driven practices and research, support and community building, educational and professional development, leadership responsiveness, and advocacy. And then the opportunities was technology and AI integration, as I mentioned earlier, enhanced support for new nurses. So we're doing good work, but it doesn't end. We're not done. Intergenerational mentoring and collaboration. I thought this one was always really nice, and it was from all generations. So it wasn't like an older generation being like, we need to mentor the young guys, but it was like the young folks going like, we'd really like to learn and engage with you more. Like there was a lot of like a lot of appreciation, improved collaboration and resource sharing, focus on workforce needs and retention, and community engagement and outreach. So these kind of coupled together bolster the aspirations in a way. So you can think like what we do well, what we could do, and then it's like the next step is like, but what do you want to do? And those aspirations these are the high level. We'll be paring them down. We'll be bringing fewer aspirations. The aspirations will turn into the strategies that we select. Eric has guided us like 6 is too many, 2 is too few, find a sweet spot in the middle. The blue is what I really think of as the aspirations, and the green are probably the strategies. I would identify them probably dropping down to a strategy on how you fulfill the blue. That's how my mind is thinking about it. Y'all correct me if I'm wrong. Technology and integration in nursing, workforce support and retention, well-being kind of falls into that bucket right now. Enhanced nursing education, professional development, nursing well-being and professional identity. Workforce support and retention is separate from nursing well-being and professional identity. We've been shifting things around already a little bit. And then the other aspirations, mentorship and leadership, advocacy and policy influence, and innovation and problem solving. There's been some interesting comments throughout this process. Rose, I can't stop thinking about you calling us like the church, like come as you are, we're welcome to have you. A lot of people have talked about wanting more policy influence, wanting more of a unified voice, wanting more invitations to join in innovation and problem solving. And that's why I really thought of those as strategies. Like that's how we do this work. but not necessarily the goal itself. I think these are nice though. I think that there's something that we can build from. I think that there's a bit of what we do and we can imagine how to grow. And there's some things that are brand new to us, like technology integration in nursing. We do have the SIM collaborative, but I wouldn't say that that's a big part of our work. And I think that we can think about how to integrate that in many ways. Like, are we using these tools to optimize the programs and services that we provide, or are we providing guidance on how nurses can use this in practice? Both are probably possible. Does anybody have any questions about this section? No?
It's looking,
right.
it's really shaping up, huh?
Yeah, it's been, I think, choosing a process that is very focused on the appreciative inquiry has also been really recharging. It it's not been the nicest 3 years, I will say. Not that I don't love the staff, I do, and love the advisory board and love the community. The work is good, but the work is hard. And when this kind of like heady strategy focused work, but always feels like the rug is being pulled out of out from under your feet, it's tiring. And I think a lot of us, like, aren't all of us in that position where we feel like, you make a little bit of headway and then like the Dire Straits songs turns on and you're like one step forward and you're like 2 steps back already. Like, it's just this cycle. And to invite our whole community to come and do this exercise of appreciative inquiry, I think has been really nice for others as well as for us. So, and it's kind of shaped up really quickly, which I've appreciated. It hasn't been, it's not like you look at this and you're like, oh, but where is it forming? Like, it formed very quickly as well, these buckets. So we will have, there will be a lot more of activity over the next month, and then we'll be working to kind of launch these things. I just want to put this a little bit in context. Carrie has her workforce projection report that will be coming out in April. We will be launching these strategic plans. And y'all, we turned 20 this year. So this is kind of a big momentous year, and we're putting some big things out all at once because, like, come on, let's celebrate, let's go big. Also, I'm an introvert, and so I know that we should have a celebration, but I am like peopled out. So Leanne is very excited about it, and she's not an introvert, and she will be making those plans. So there will be like some big things moving forward. And this is a big momentous time for us, and for us to be able to kind of find our foot after these 3 years where we've done really good work. But we also know that we can't keep on doing the same work that we've done for at least the past 10 years, because that's not going to take us into the future. We are still doing good work, but we are seeing that our needs are growing beyond what we're doing. So we have to think about that growth. We have to have those projections. We have to have that aspiration of what the future could be. And we have to move forward, because right now we don't want it to be like, well, we've done a good job for 20 years. We've done a great job for 20 years, but what are the next 20 years going to be? So with that, like, this is a very fun year to spend with you all. Okay, other business, a couple things. We are going to have our first Hawaii Transition to Practice conference. So that's our first one. That has been a goal of our NRP, now Hawaii Transition to Practice program. It's been an aspiration since at least 2014. We figured out how to build it. So that will be coming in April 2025. It's primarily grant funded. And so with that, we are able to pay for travel for a large amount of our neighbor island participants to help with engagement. And there's also going to be awards. So they've been asking for preceptor and residency awards for quite a number of years, and we're going to be doing it. So we have the Outstanding Nurse Resident Award, the Education Innovator Award, and the Outstanding Preceptor Award. There is not like a one person per award situation. There is a multiple person per award situation. So feel generous with the nominations you write. We also are having our national conference in Philadelphia. It's going to be, it's focusing on innovation, strengthening the nursing workforce. Carrie talked a little bit about the group earlier. This is really like our group of people nationally. It's really fun. The last couple of years, we've had the Center for Nursing has had some great presentations, and we also learn what else we can do when we go to these conferences. We do have some travel supports for advisory board members. So if you're interested in going to Philadelphia in June, come with us. And then finally, the last thing is that we have our advisory board meeting schedule. It is a little bit changed because I'll be out of pocket late February through mid-March. So we moved that, we moved the meetings around a little bit, and then we're trying to find a little bit more equilibrium with our meetings. So we don't meet during the summer, but we do have this recognition that things kind of feel pinchy, particularly around graduation and around start of school. It's very hard to meet with you all because you all are very highly responsible people to other big initiatives. So with that, so we have the January 29th meeting. That is today. February 19th, instead of having a February meeting, instead of calling you in for the evening, we're asking that you make your time for that strategic planning session. April 16th, we'll have a regular meeting. May, we thought maybe we used to do one offsite visit and then one Zoom call. So if we want to have a field trip and go somewhere and have a presentation by one of our partners, please give a suggestion. August 23rd is our Saturday meeting. We do professional development, or we can focus on one of our strategic planning priorities. And then we'll have that regular meeting on November 12th, which is the Wednesday. So please put these in your calendar. Bree will also send them out. And if you do have recommendations for the field trip in May or the professional development, please let us know and we will work on making it a reality.
Minor typo, I think November 2025 as opposed to 2024.
You're right. We will not be going into the past. Thank you for correcting that for the record. Let me check though. The 12th is actually a Wednesday. So the day and the week is right, and the year will be 2025. And I've been writing like 2014 lately, so I'm not even in the right decade. New year, 10 years younger.
Yeah, this is Kong Hee Fuat Choi, right? The Lunar
Yeah.
New Year, yeah.
Yeah.
Yep.
All right. Well, with that, I believe that we are at the end. I don't know, Anne, if you have any parting words for us.
I don't know, that was one extremely impressive set of reports. So I concur that it's been a remarkable 20 years. And I wouldn't expect anything else from you guys and your brilliance than to help us go into the future. Because there's a lot of things that can be done. There's a lot of complaining done, but I think that appreciative inquiry process really was challenging to be quite a bit more positive. There's a lot of things that are going well. And if we pattern off of those, we can keep busy with things that matter. So I just really appreciate that leadership, and I appreciate the productivity of this board. And I appreciate all you guys who work so hard and are still here at 7 p.m. So that's that. We'll adjourn the meeting.
I was in the first advisory board in 2004, so we've come a long way. I concur.
20 years of
Yeah,
service.
2004, I was in the first advisory board, and the leaps and bounds from then to now is quite impressive. How Hawaii State Center for Nursing has become, very has lived up to its name. Yeah.
Good way of saying it.
Well, thank you all. We are able to end a tiny bit early, but evening meetings can be hard. So after reading the intershift recovery, I just want to let you know that taking a walk, getting a little bit of exercise, getting a full night's rest is very important. And I just want to say also thank you so much for the work that you do.
Thank you, Laura. Thank you,
Everybody.
Thank you very
Center.
much, everyone.
Good night, everyone. Good work.
Off we go.
Thank you.
Good night. Stay safe in the storm.
You
Yeah.
too.
Yeah.
Bye, you all.